Welcome back to AM Prime, ladies and gentlemen. This morning we're speaking about your eye health, particularly eye health and exposures to ultraviolet rays. Prolonged exposure to UV rays emitted by the sun can lead to severe eye damage, including the loss of sight. Well, to expand on this conversation, I'm joined this morning by Dr. Ronnie Bhola. He's a consultant ophthalmologist. Good morning and welcome to the program.
Thanks very much for having me.
Well, thank you very much. Thank you very much for joining me, Dr. Bhola. First of all, precisely how can the UV rays, how can that affect one's eyes and one's eyesight?
Yeah, well, what happens is the rays are emitted from the sun, as we know, and there's a spectrum, and the UV part of the spectrum is the part that could cause damage to the eye. And really, you wouldn't see these rays. They're being emitted all the time. And exposure or excessive exposure to these rays can cause certain types of conditions of the eye. Just like you can get a sunburn on the skin, the rays also affect the tissues of the eye, that is the surface tissues, or deeper tissues like the lens or the retina, and they could cause inflammation, which is damage to certain cells, the little cells, and then these cells get a little inflamed, and then they cause a little bit of scarring or change within the cell structure that could lead to conditions in the eye.
Mm-hmm. So let's expand on that a little bit. You said conditions to the eye. Are there vision-threatening conditions, even diseases, to prolonged exposure to UV radiation?
Yes, well, one of the things is prolonged exposure. The other one would be the intensity of the exposure. So us being living on the equator or in the tropics, the Caribbean, Trinidad, we're at high risk because of the intensity of the sunlight that we get in this region. And, as you age, you're going to have long periods where you're going to be exposed to the sunlight. So it's really, really important that if you live in the tropics or you live in Trinidad, which we are, you take precautions to protect your eyes from the damaging effect of prolonged exposure, but also the intense exposure. And one of the groups that really I want to talk about is kids. Kids' eyes are 3 times more susceptible to UV light exposure damage than adults. And now we're in the holiday period. We go into the beach. At the seaside, you don't only get direct sunlight exposure, but you get reflections of the surface of the water. And the reflections could be as damaging as the direct rays. So you have to be really, really cautious about the kids. Make sure you protect the skin with cover, and in the sun-exposed area, you use the sunscreen. But the eyes also, you need to think about how you protect the eyes with sunglasses that gives you the UVB, the UVA protection, 99 to 100%. That protection, plus you wear hats. The brim hats is the best type to protect you from the sun.
Mm-hmm. Dr. Bhola, why are children more at risk if exposed to UV rays?
It's because of how the lens in the eye, as it develops over time, it forms layers every decade or every year that you're alive, right? And what that does is it blocks more and more UV rays from entering the eye, and therefore protects the most important structure of the eye. Well, retina, people think so. It's the retina, it's the macula. And that macula needs to be protected because it's very sensitive to rays. Another group of people who, I want to advise is people who look at the sun in the early morning. It's supposed to be a really meditative thing. And this group of sun gazers have to be careful because direct viewing of the sun could cause damage to the macula, toxicity to the retina. So not only UV exposure in this time is important for beachgoers and kids and adults, but also people who might be interested in doing sun gazing. It's not a recommended activity.
With regards to your experience as a doctor here in Trinidad, would you say that you have well-documented cases of the effects of ultraviolet radiation on the eyes and on eyesight?
Yes, one of the conditions that we see in Trinidad, and it's well documented also in surfers in Australia, is pterygium. That is right in the corner of the eyes, the medial part, the corner here. You get these little wing-like fibrovascular tissue growth, and you may have seen it in people. The most famous person who had one is Brian Lara, and he had it because he spent so much time out in the field that he was exposed, a lot to the UV radiation, and he developed the pterygia, or the growth on the inner aspect of the eyes. So this is one of the most common ones we see in our practice here in Trinidad, because we live on the tropics and because of our lifestyle, our outdoor lifestyle. And really, we need to emphasize protecting the eyes with sun glasses, protection, and also wearing, hats. And that's why you see these cricketers have the brim hat. It's really the best hat for protection out in the sun from the UV.
Now, this is a bit of a tricky one to understand, and I'm hoping you could explain it with regards to eye color. Even eye color could have an effect with regards to, the exposure of UV rays could affect certain eye colors more than others.
Yes, so some groups of people need to be more cautious than other groups, or be more aware. And as we were discussing kids before, now is the holiday period, the August holidays, you go into the beach and elsewhere. You must protect the kids, as we were discussing. The skin, the eyes, the 99 to 100% UVB. UVB is the main one that affects the eyes in a detrimental way. So you're looking for your sunshades with this UVB. They usually stick on the shades the amount of protection you get from UV. So, you look for the ones that have the high protection. Almost all sunshades that we get now, even the ones over the counter, would give you the 99%. So don't be worried that you need really expensive shades. No, the standard shades that we get give you full protection from the UV. Now, what you mentioned is another group, not only the kids are at risk, or the age population, which has had prolonged exposure over their lifetime, but also the light-colored eyes. Luckily, in our population, the majority of eyes are highly pigmented eyes, which is the brown or the darker color iris, which is the colored bit of the eye. So if the smaller bit of the population who has the blue colored eyes or the lightly pigmented eyes, they are at higher risk because that lightly pigmented eyes allow more of the UV light to enter the eye, and therefore you have a higher chance of getting damage to the eyes, and that's why we see it. We think that they are at higher risk, the lighter pigmented eyes.
All right, so we've spoken about preventative measures. Now let's speak about treatments associated with those who would suffer from vision-threatening diseases or conditions associated with exposure to UV rays. Now, I know there would be different treatments for different conditions, but let's speak on that. Generally, when testing an individual who has been exposed to UV radiation, prolonged UV radiation, what do you observe?
So the two main conditions that we look at or think about mainly is the pterygia, the growth on the inner aspect of the eyes. And these usually produce redness and irritation. And the two things people don't like, because if it's on one side more than the other, then it's cosmetically an issue. And then symptomatically, when you're out in the atmosphere, or you're at work and you're outdoor, you might find it gets more inflamed, and then it gives you symptoms of watering or epiphora. It gives you irritation. It feels gritty, and those symptoms sometimes lead them to come to the ophthalmologist, which is us. And when we look at it, we then decide, well, what to do, if we should treat with drops and try and relieve symptoms, or if we should think of removing the pterygium with surgery. So sometimes we able to quiet down the redness and get the eyes looking pretty much normal again, just with some drops and some cool compresses. Or sometimes we have to say, well, this one is maybe coming across too much, and surgery is the better option, because you don't want them to come across the visual axis, which is the central area, and then that produces scarring of the cornea and results in vision loss. So we make a decision based on size of the pterygium, location, and the amount of symptoms.
Mm-hmm. No, but very often, though, is surgery more so the option? No.
Most of the times, these growths are treated conservatively with drops, and patients are not, because it's been there a while, they've gotten used to it being there, so they're not as bothered by it in terms of appearance. Mm-hmm. And a lot of the symptoms is very treatable with drops and other therapies.
And with regard to, I just want to go back a little bit in this term prolonged exposure. Exactly, how would you define, what would you define as being prolonged? Because I know you mentioned we live in the tropics, but precisely what would you define, in your opinion, as an eye doctor, an eye surgeon, what is prolonged?
Well, again, I like to talk about the groups at risk. So, people who work on a job site, or people who work, who go to the beach a lot, they used to call it the surfer's eye. And there's a reason, because if you're in these environments where you have exposure all day or very regularly, if that's part of your job, then you have to be much more aware that you're going to be at risk. And then the other group is obviously when you have the holiday for 2 months and the kids just go outside and you leave them for 8 hours, you really need to be aware that they're out in the sun there and they're going to be exposed for a long period of time. So prolonged could be in 2 ways. One is an intense period of a couple of months, like how the kids are off from school now, and we're hoping that they're outside because you don't want them on the screens all the time. That's another problem. But yeah. And then length of time. If you're a let's say you're working on you're a contractor or other, and you're on job sites, and that's your job, then you're going to be 20 years out there. You need to be aware and protecting yourself. Some people drive for a living because they have to travel around in fields, and that means they're at risk because they're out there on the roads, and there's a lot of reflective light coming towards you. They have the UV, so you need to always be aware and protect yourself once you're going outside.
Right, so let's go back now to where we left off with regards to the operation procedure of removing that particular growth. Usually, how long is recovery following that particular procedure, or does it vary?
So in the surgical removal of the growth has evolved a bit. So if you allow me a little flexibility in time,
sure,
I'll explain. In the early days, we used to just excise these growths in a very short time, 5-10 minutes. It was a very quick procedure. We did it in the clinic very quickly. The problem with just a simple excision of the growth is that there is a high recurrence rate for regrowth. And therefore, we started to work on developing better and better methods of removing the growth and minimizing regrowth of the pterygium. And to do that, one of the best methods is to use a graft, which is take some conjunctiva, the same tissue that is here that is now caused a problem, and we take tissue from another location. Usually it's the area below the lid, and we take that tissue and we use that in the area that had the disease or the damaged conjunctiva. So it's a disease of what we call the covering of the eye, which is called the conjunctiva. We remove the diseased conjunctiva and we put a graft, we replace it with another type of tissue, with another piece of the same conjunctival tissue, just of another location. So we use our autograft, auto meaning your own tissue, we use to replace. When we do that surgery, the recurrence rate is as low as 1%. So we really reduce the recurrence rate tremendously. And therefore, the surgical success is very high now with pterygia surgery. The only issue really with the surgery that I know is the length of time we take to do the procedure. It moved from a 5 to 10 minute surgery now to a 45-minute surgery, which means there's no really discomfort for the patient who undergoing the surgery, but it means the cost goes up and the time the surgeon takes goes up. So, you know, we now sacrificing a bit of time for an outcome, which I like because you really want to ensure that the patient doesn't need a second surgery at all. The recovery period, which is what you asked, is quick because as you could imagine, if we remove the tissue, do the graft, the only thing there is the eyes look red, but you actually see well from the eyes within 48 hours to 72 hours. So within 2 to 3 days, you actually could see and function, you know, pretty well. And there's very low risk for the surgery. Infection is not an issue. It's a very safe procedure to have. You do feel a little bit of the stitches because we do use 1 or 2 there, and they feel a little gritty for just about 2 or 3 days. So everything is about 2 or 3 days for recovery. The eye would look a little bit like you've had something done to you for about 3 weeks. So it does take about 3 weeks for full recovery to occur.
Mm-hmm. Well, that seems rather complicated, but I'm glad that you explained it. Because also I would have asked what are the risks or the complications associated with it, but from your explanation, there are very little risk, very little complications, and even the 1% chance of regrowth. That is quite amazing. Dr. Bhola, before we bid you farewell, are there any other messages that you'd like to extend to the citizens of TNT this morning and viewers wherever they're watching this program this morning?
Yes, you know, it's UV Awareness Month, and we want you to be aware that you can protect the skin, you can protect the eyes very, very easily by wearing clothing to protect you when you go out in the sun. And in the sun-exposed area, make sure you use the sunscreen on the skin. My dermatology colleagues would love me today. The other thing I want to tell you is you have to protect the eyes because you need to be aware that you can develop problems, especially in Trinidad, from sun exposure. So if you're going out in the sun, you know, especially the kids, you want to protect the kids from the damaging effects of the UV on the eyes. Remember, they had more risk than us. So make sure you get them wearing their sunshade. Make sure you clothe them well as they're going out in the sun. And in the sun exposed areas, you use the sunscreen. And the best hat is the brim hat to really prevent that sun from getting to the eyes.
Certainly. Dr. Ronnie Bhola, thank you very much for joining me this morning, and thank you so much for your time in explaining the factors associated with UV radiation exposure, preventative measures, and even treatments should that become the case. But thank you so much, and wishing you all the very best.
Thank you. Have a great day.
All the best. Thank you, Cyril. Dr. Ronnie Bhola this morning joining us as we speak about ultraviolet radiation, prolonged exposure and the effects on eyesight. Prolonged exposure could lead to vision loss, but as Dr. Bhola stressed on this morning, especially towards those who are more susceptible to any sort of vision-threatening diseases or conditions. There are preventative measures, very simple and inexpensive actually, and you do that to try and preserve your eye's health and avoid having to have any further treatments. You make his job and life easier, and you make your job and life a lot easier. Ladies and gentlemen, we take a break here on AM Prime. When we return, we'll continue this morning's edition of the program.